as our next speaker will testify. He's just finished his new book about tokenomics, which I'm looking very much forward to reading. But reading and writing is also his yin and yang, because his happy place is reading bedtime stories to his 3 children. So, with that said, Sean Au, here to speak to us about bundling models in healthcare blockchain.
Thank you very much, Tom, for this. So we all know that our health is super duper important, but we don't really notice it until we've lost it. We're lying in bed, our body's aching, our eyes are throbbing, and we load up on vitamin C, fully knowing it doesn't really help. And blockchains and the price of Bitcoin is probably the last thing on our minds. But if we back up the truck a bit and think of the time that you went to the GP, and you may have had your test taken, or you were serious at an X-ray, do you ever think where that information was stored? Whose is it, for example, and how do you get access to it? Well, folks, hopefully in the next 15 minutes, I'm going to talk about if blockchain can help reduce healthcare costs. Is it possible to incentivize good health behaviour? And also we'll look at some health token examples as well. Just a bit of background about myself to give you confidence that Tom didn't pick me up off the street to talk to you this evening. I've been in the blockchain space for about 3 years, full-time, eating, sleeping, breathing this, studying Bitcoin code base from the ground up with blockchain, smart contract, the whole works. I have spent the last 12 months looking at a book. It's one of the hardest things I've done in my life. It was supposed to be finished for this event, but it wasn't. It's delayed. However, if you are interested, let me know. I'll hook you with a discount code. My orders with the publisher. Down in Wellington, I also help look after the community there, along with Mark running the Wellington Blockchain Meetup. You can see a couple of years ago, there was a bunch of us sitting around the table. And then last December, in correlation with the all-time high in Bitcoin, about 60 to 70 people turned up. And just last week, we had another blockchain meetup, and you can see a whole bunch of chairs, 20 people turned up. So that's the way it rolls in crypto. So to look at how blockchain can reduce healthcare costs, I want to look at 3 main areas. What the current system is, what blockchain is itself, and the value that it provides. And a lot of these concepts have been alluded to by previous speakers as well. So the current system is that you've heard that the information is quite siloed between the different parties, the GP, the physio, the pharmacies, the hospitals, etc. And if they are connected together, then the information can sometimes be slow flow across the different systems. And have you ever tried obtaining information from your GP or the lab, for example? I had my blood tests taken a couple of years ago, and what the GP said is that the lab, AATF Pathology down in Wellington, would send the results to my GP, and then he would contact me if there was a cause of concern. So I'm sitting and waiting, and in this day and age, silence to me is not quite golden, but it's a bit of a risk, because I kind of want to know what's happening, where it's in the process, and how long I may have to wait. And even if it's okay, I'd still like to know. So let's park that concept for a second and talk briefly about blockchains, because as we've heard, it's just a slow distributed database, a place where you can put information. Now, it's not truly decentralized in a sense, because if you look at a blockchain in the public sense, where it's open and it's permissionless, etc., yes, you can use that. But what we're seeing is that a lot of the people in the healthcare industry, the pharmacies, the hospitals, the GPs, are coming together to form a consortium-based network where you can go and put your information there and track it in that sense. So although it's not controlled by one single DHB, for example, which would be totally centralized, there is a degree of decentralization. So You'll read about in the media how it might be totally public, or and decentralized, or centralized, but it can lie anywhere in between as well. You may have come across supply chain with pharmaceutical, the drugs come from the raw materials through the supply chain in a very linear fashion. The blockchain world would be represented like that. But I'm not going to talk about supply chains, and I'm not going to talk about health and life insurance either, because again, this is another use case where your premiums can be tied to potentially your health. What I do want to talk about, and this is where a lot of time is spent, is on EHR, electronic health record. It's by far the most common use case that people have talked about as well. So it all starts with when you were born, your date of birth, maybe your midwife might have a cell phone with a GPS location, it can stamp and prove your date of birth and your house, and then it follows through until at the very end there as well. And you can take it with you when you go overseas. Has anyone ever tried requesting their blood test results? A couple of people? Okay. So hopefully this process is similar to what you experienced, where I went in and filled in a form and then provided my email address. And then about a week and a half, 2 weeks later, I got a PDF in my email. And then I also had another email with a password inside. And then you open up and it's fascinating. This is what you get. And I don't fully understand this, but it is interesting. And there's some guidelines down below where it says your total cholesterol should be less than 4 millimoles per litre. Now, the screenshot above shows me at 3.9 in 2014. And then down here in 2017, it said 4.0. So I'm borderline on this criteria here. But it's very fascinating. And you can see this being placed on a blockchain so you can get easier access to it and potentially understand more by going to other people and asking and learning. So what value does it add? Well, in this network, the decentralized world, the information can be better exchanged between the different parties involved. All those parties I talked about earlier. Patients have control over their data because it's yours, and you can choose who you want to release it to, using very complicated and fascinating mathematics. It's more secure because there's no single point of failure. And in fact, there's cost savings there because there's less chance of being hacked, for example, or a data breach in this secure network. And there's also increased transparency. I'm just going to play this short example here.
In our world today, with the technology available, could healthcare be better? Today, doctors, nurses, and health professionals are limited in the level of care they can provide. This is due to the inability to view your complete and accurate health record.
At CareChain, we believe that by putting patients at the heart of healthcare, we can truly improve people's lives.
With CareChain, you have full access and control over your own personal health data. Users are able to grant doctors immediate access to their health record via their mobile device. CareChain keeps electronic health records safe and secure using blockchain technology. The blockchain layer of CareChain hosts limited, non-personal information. This information acts as a pointer, directing the system to your encrypted health record. Encrypted records are held within hospitals, universities, and nonprofit organizations regulated to handle sensitive data. Only your authorization can unlock your health record and allow it to be viewed on the mobile interface. But CareChain is much more than a way to view patient electronic health records. Services such as telemedicine consultations are available with CareChain. Your doctor can check your progress with access to your medical history. Wearables ensure that doctors can access life-saving information when managing vulnerable or unconscious patients. CareChain provides peace of mind. You can feel safe knowing your health data is accessible to you and your doctor when it matters most. We are transforming healthcare, with health professionals, patients, and technology specialists from around the world. We hope you too will
stop there. So you can see what's coming in the future, and this is just an example, medical chain where they launched an ICO, or a token sale, earlier this year and raised $24 million.
30 million.
Oh, 30 million. Okay. There's a website, myclinic.com, where they are running into production. Just a simple use case of what's happening out there as well, where it talks about telemedicine happening. Let's now move on to us. Is it possible to incentivize us to increase our health? Well, yes it is, because as you may know, we're all very economically driven. When something's on special, we generally buy more of it. And I'm thinking of fruits and vegetables as opposed to an iPhone. But the whole idea of this token economy can be shown in this diagram here, where we've got on this side the healthcare blockchain infrastructure. Up above, we've got the technology which centers around sensors and wearables to grab the information that's stored on the blockchain. But the question is, why would you want to give this up? And this is where the tokens come in down below, to reward us for this information. On this side here, we've got finance, so you can go and redeem your rewards, you can exchange it, you can get lower health premiums, for example. And out there in the marketplace, there are hundreds of health tokens out there. This is just a sample screenshot from the website down here, Crypto Slate. And you can see what DentaCoin, AI Doctor, down below, EncryptGen, storing genomic data on the blockchain as well. I want to talk about one example here, Sweatcoin. Has anyone come across this? One. Have you guys tried the actual app? No? It's an application that is designed to incentivize you to get active. It's a mobile app here where you keep it with you, and every 1,000 steps, you get just under 1 sweat coin. And you might be thinking, well, what do I do with these sweat coins? Well, how about a trip to Borneo? Maybe an iPhone 8 or something. These may be trivial examples, but it's just to give you an idea of where this is heading. Another one here, Coin Health. These guys, interestingly enough, are running an ICO now, and I'm not affiliated at all, so this is just stuff I found on the internet. What's interesting about these guys is that you can see that their goal over here is to provide a singular collaborative platform for patients and the providers. And up above, the data generated by mobile devices, cue wearable technology, sensors, etc., to integrate into a decentralized EHR, electronic health records. And down below, it talks a little bit about smart contracts, which some of the previous speakers have mentioned as well. Now, in the blurb, there was a little section on the energy used inside Bitcoin and blockchain, and how it's quite a waste. Here's an example of folding coin. Has anyone come across folding coin? No?
What is folding coin? Folding coin is a digital token that compensates participants for their folding at home computational power. These computations are aimed towards medical research by doing Stanford's folding at home protein simulations. This research can then be used to help find cures for cancer and many other diseases. Folding at home allows anyone, anywhere in the world to work towards finding cures for diseases. When your computer is idle, spare computational power is lost and wasted forever. Folding at home utilizes the spare cycles of your computer to work on protein simulations that scientists need solved through distributed computing. The Folding at Home network currently consists of over 100,000 participants using their computer spare time to work on simulations for researchers. Folding Coin provides compensation to help cover donors' computational expenses, such as electricity and computer parts. Every month, donor stats are calculated and are rewarded points by folding at home. These points show the community how much computational power you are donating to research for cures. Folding Coin is a digital token that is paid out each month to donors based on the amount of points the donor received that month. In addition to Folding Coin, participants can earn additional tokens being distributed, such as our partner coin, CareChain.
There we go. It talks about all the other benefits of it as well. But again, you can see how you can use the computation in a useful purpose as opposed to in Bitcoin, just wasted energy to secure the network. So in summary, can blockchain reduce healthcare costs? Yes, it can, by the value that it provides. Can we incentivize good health behaviour? We definitely can, using tokens and this new token economy. And you saw some examples there of Sweatcoin, Coin Health, and Folding Coin as well. So just to summarise and end, the healthcare industry is changing at a phenomenal rate. And all the information you've heard this evening is contributing to that. And as leaders and decision makers in the room here, you have a great opportunity to help see the future of healthcare within New Zealand and globally.